Hello again, it's Ross Miller with Sonitus Medical and with another presentation on SoundBite ITM Fit and Adjustment. And again, ITM stands for in the mouth. It's the part of the SoundBite system that goes in the mouth, and the part behind the ear is behind the ear. The topics here, the dental criteria, kind of update with the FDA's our criteria, dental criteria for the FDA. Expectations of the patient, setting the right expectations at the time of fitting. Fitting and adjusting, the ITM components, why the ITM might need adjusting. ITM where to adjust, and then techniques for adjusting, how to actually do the adjusting of the device. The FDA indications for use are that the SoundBite is a bone conduction prosthetic hearing device and is intended for the following patients and indications. Patients who are 18 years of older, have moderately severe, profound sensorineural hearing loss in one ear and normal hearing in the other. So these are basically defined as single-sided deafness. Patients with a conductive hearing loss. Additionally, the use of SoundBite is intended for patients with at least 2 contiguous molar or premolar teeth with no untreated tooth decay. Now this kind of pushes the limits a little bit. You'd like to have more teeth up there, but this is the very minimum that is required by the FDA. Patients with tooth decay present are to first have restorations before being fitted for SoundBite. Healthy attachment to those teeth with tooth pockets limited no more than 5 millimeters. No mobile teeth. No significant bone loss, i.e. bone loss no greater than 34%. As measured on the x-rays. So the teeth have to be healthy, they have to be restored, and you really can't have any pockets greater than 5 millimeters and no excessive bone loss. So that's the dental criteria for patients. Now let's jump into the expectations on the side of the audiologist. So the ITM goes in the mouth. It's in the mouth to place the bone conductive part through the teeth into the bone so that patients can hear better. But even though it goes in the mouth, this is not dentistry. This is it's simple stuff. The SoundBite has no dental function, although it has a dental platform. So we really need to work together, the partner dentist and the audiologist, with our patients to make sure that these teeth are healthy, that the SoundBite is going on. But again, the device that's going in the mouth has really no dental function. It's purely for hearing. Show confidence. Listen to the patient. These patients have been cleared by the dentist. It's normal dental anatomy or restoration should be present. And spend some time with your partner dentist. Understand the dental side of this device. Some of you are very new to the SoundBite, and the mouth can be sometimes it's a little bit intimidating. But work closely with your partner dentist, and they can really be your best friend in understanding the mouth and how these devices fit around the teeth. Expectations of the patient. The patients are usually used to nothing in the mouth, and what you have here is sort of like a small retainer or a partial denture. That's basically what the ITM is. And it's going to take a little time to get used to. Some patients are going to be very accommodating to it, but other patients are not. It's similar to what you do with your hearing aids. I mean, some people tolerate it and some people do not. But usually we can work through any issues that patients have and get these things to fit. There's 2 considerations with the ITM. One is comfort and one is hearing. If it's not comfortable, it's not going to have any value for the patient when it comes to hearing. They've got to be comfortable in order for the hearing to be improved by the SoundBite. When it comes to chewing, set the expectations realistically. Start with soft food, yogurt and soup, then try harder foods and baby steps. I mean, sometimes patients might take 2 weeks to a month to get used to these devices, to get used to the ITMs and SoundBite, and give it time. What you're seeing with these patients is pretty normal. It just, the device interferes with the tongue a little bit, and it pushes on the gums. These are normal things. Speech should not be affected. The way the patient hears their own voice may be a little different, and the ITM fits between the teeth, the palate, tongue, and the cheeks. So it kind of fits up in there in the mouth and puts pressure on all these areas of the mouth. When you're initially placing the ITM in the mouth, coach the patient on how to put it in the mouth by using the model. There should be a model present in the office. Let the patient put the ITM in the mouth. Should take about 15 seconds or so. Should fit comfortably. There should be a little snap over the teeth. Dental anatomy varies from patient to patient, and patient's attitudes towards treatment varies greatly, and that factors in a lot into the SoundBite patient. ITMs will move a little bit. These are removable dental platforms. They're not fixed to the teeth. They're not cemented to the teeth, and they're not in any way, shape, or form attached to the teeth. So these things are free to move a little bit, and some patients, it takes a while for patients to get used to that. Setting realistic expectations from the very beginning is important, and the patient's musculature varies from patient to patient. I mean, if a patient opens really, really wide and they hit the actuator a little bit with their a part of the jaw called the coronoid process, well, they don't have the patient open that wide. I mean, this does have to fit in the normal anatomical positions inside the mouth, and if a patient moves the muscles a lot, they will feel it and possibly dislodge it. Initial placement, look at the teeth. There should be undercuts there for the ITM to fit over. It should have a little bit of a snap when it goes in. You can freshen them up with some mouthwash. We always like to do that. That way they taste good. Because when they come out of the manufacturing, sometimes they have a little leftover acrylic material on them. And sometimes it can taste like acrylic. And the mouthwash gets rid of that. Have the patients place on the teeth, and then they just snap it into place. Very simple. Some of the components coming from the upper left and counterclockwise. You have the actuator. This is the part that actually sends the vibrations through the teeth imperceptibly and allows the patient to hear better. The actuator nub is the only part of the actuator that should touch the teeth. It usually touches two teeth, usually the first and second molar, but it can be a bicuspid. The battery is on the roof of the mouth on the palate side, and then there's palatal acrylic for retention. And the hypotube connector and wire from the battery go through that hypotube and power the actuator from the battery. And that hypotube is a tube. It's not a wire. It has little tiny wires inside of it. Little electronics go through it, and so be careful when you adjust that. From above, the actuator should fit. Again, tapping two teeth, just basically touching on the two teeth, and fitting down below the height of contour of the most posterior two teeth. From the front, the actuator should touch both the mesial distal tooth, but only on the nub. It should only hit on that little nub that we talked about earlier. Here's some nice fitting ITMs. It fits into the embrasures and undercuts of the teeth, and you can see it just kind of fits right between the teeth, right in undercut. These things click into place, and this patient has some nice anatomy for these to work in, to be nice and snug and in place. How and where might the ITM not fit? Well, these are out of occlusion. These really shouldn't hit the teeth when the patient bites, but we work with the natural anatomy of the patient, and anatomy varies greatly. The patient's occlusion will vary greatly, and the way they feel these and the way these fit will vary from patient to patient. So the patient might bite on them. They might bite on the wire or plastic. They might also say they are loose. They might also say that they're too tight. The patient may, to the patient, it may be a little sharp to the tongue or the tissue. It might feel strange, new, or different. Anticipating and avoiding possible denture sore-like problems is critical in these with the ITM. Patients that really get a huge benefit out of the SoundBite will more than likely they're more likely to develop a denture sore because they're wearing them all the time. So if a patient comes out after being fitted with these and they're wearing them 20 hours a day, the patient may be they need to get used to it at first. So remove it, have the patient rinse their mouth with warm salt water. These are the patients that might develop a little tiny sore in the mouth, and sores in the mouth generally heal pretty quickly. The mouth is mostly scar tissue because everybody's burned their mouth and everybody's cut their cheeks and stuff up, but the mouth is a little bit different tissue than you'd find in the ear canal. It's mostly scar tissue. So things heal up pretty good. So techniques for adjusting. Why the ITM might need adjusting. It might need to be tightened or loosened, adjusting acrylic to make the device more comfortable, anticipating and avoiding possible dental sore-like problems, and making the patient feel more comfortable. SoundBite, moving the actuator occlusal or gingerly. So you see below here an actuator that has a little red spot on the plastic part there. That's because the patient's biting on it. Okay, our lab does everything they can to keep these out of occlusion, but sometimes the patients bite. You know, the way teeth come together, teeth are designed to chew whatever's in the mouth, and there's not that much room in there. So sometimes these have to be adjusted. In my experience, probably about 10 to 15% of these have to be adjusted. Even if the lab has upper and lower full arch impressions and everything possible, mounted casts or whatever from a high level of dentistry, you still need to adjust these from time to time because these are resting on the soft tissue, and when these get between the teeth and the soft tissue, you hit them a little bit. It's really not that hard to do. You can adjust the you cannot adjust the actuator. The black parts on here, the gray parts on here cannot be adjusted. So that's the battery housing and the actuator. You can adjust the hypotube and you can adjust the palatal acrylic. To tighten these up, we use the 3-prong pliers, and these I believe you should have in the office. They're great for tightening. Try to be symmetrical to avoid secondary bends out of the plane of the wire. What does that mean? Well, hold the device so the wire is parallel to the floor. So the plane of that wire that you see, of the hypotube, is in the plane with the floor. And then bend using the 3-prong plier with a single prong on the inside to tighten. Most of the time you'll be tightening these. Rarely do we have to loosen them, but it's just basically the reverse. And you can always practice with a paper clip or practice on the model that we gave you, the non-working ITM. You can practice on those all you want. These are basic simple denture or retainer type adjustments, and ask your partner dentist if they can help you with this if you have any questions. Always start with the minor adjustments and test fit in the mouth. You don't have to do much bending to make a patient happy. Sometimes just a little minor bend is enough to make your patient feel like their ITM fits a whole lot better. So when it comes to bending, less is more. Techniques for adjusting the acrylic. Once you place the device in the mouth, you have the patient bite their teeth together. If they feel like they're hitting it, you might want to use some of this articulating paper you have the patient tap on it, grind around, and then you take an acrylic burr and a slow speed and just kind of grind that area off. Or a Dremel. Your partner dentist will have a slow speed, and you can get a Dremel just to adjust that. It's basically a little hobby Dremel, and a rubber point to polish it up. These things are very simple things to do, and these are probably the 2 most common adjustments you'd have to do: the bending of the wire to tighten it up, and then potentially a little bit of acrylic removal if a patient's biting on it. And then these are extremely simple things to do in the office. Any questions, talk to your partner dentist or call us here at Sonitus or send us email or what have you. But these are some things that you're going to see your patients needing this. In summary, set the patient expectations correctly. The ITM will be similar in comfort to a retainer or partial denture. It's not going to be without some level of getting used to. They have to get used to it. And nothing is always better than the ITM. You got to compare it against the surgical procedures that are out there in the market. And the ITM is definitely more comfortable than a surgical procedure. So make sure that you're setting those expectations correctly. It may affect the speech a little way or the way the patient perceives their own speech. Most of the time you can have the patient talk with a close friend so that they're get comfortable talking with these. It's always more comfortable than nothing. And again, more comfortable than surgery and other possible treatments. Anticipating and avoiding possible sores is an important thing. If a patient's very happy with it, wearing it all the time, you might get a little denture sore. Take out the ITM, give them a break, rinse with warm salt water. Very simple to do. Make the patient feel more comfortable with SoundBite. I mean, just you basically have to coach them and talk to them. All the problems, any problem that they might have, is something that somebody's had before. It's nothing new. And if you need the help of your partner dentist, by all means, talk to them. And usually, patients have one favorite ITM. I think we see this quite commonly. There's usually, just like people have a favorite T-shirt or favorite jacket, they have one favorite ITM, which may be just a little bit different than the other one. These are all made the same way by the same people in their laboratory. They should be very close to one another, but if they're not, sometimes there's one that's favorable to the other in both function and fit. Just for adjustments, there's simple denture or retainer type adjustments. Avoid cracking the acrylic. You don't want to put your three-prong plier on the acrylic anywhere. Avoid crimping the tube. There are electronics in that tube. Squeeze the three-prong as you feel forces expressed with your finger and thumb. Like when you adjust these devices, make sure that you keep your fingers on the device so you can feel how much force you're expressing into the ITM. After a few months of wear, the ITM may require some adjusting because these are going over heights of contour, or the top of a tooth. The crown of the tooth is wider than the neck of the tooth, and so these have to bend out over the crown of the tooth and then back into a narrower spot. So there's a chance that they get loosened up. Keeping the dentition healthy throughout routine dental care is with routine dental care is a must. These patients that are having SoundBite in their mouth should see their dentist every 6 months, get their teeth cleaned, get routine dentistry done, and before you start, the patient should have absolutely healthy teeth, all restorations done, and it's okay to get help from your partner dentist. If you have any problems, any issues, have lunch with your partner dentist, go talk to them, and show them what you're doing, and get them involved, and feel more comfortable with the SoundBite. Thanks. Again, my name is Ross Miller. I'm at rosssonitus@gmail.com, and you can go to soundbitehearing.com for any more information. Thanks for listening, and have fun with the SoundBite hearing device.